A dental anesthesiologist is a dentist who is trained in residency to go through anesthesia, and what they offer is they offer anesthesia to the dental field. So anesthesia has a pretty wide scope, anything from a minimal sedation up to what we term as general anesthesia. And that general anesthesia is something that's used heavily in major surgeries in the hospitals. After undergraduate and getting into dental school, you'll do 4 years. And then it's an extra specialty training that you do after that, exclusively just anesthesia, and it takes 3 years. Most offices don't offer it, and the reason is because it's a high level of training that only few people in dentistry can offer. The levels below general anesthesia would be moderate sedation or IV conscious sedation. Dentists can acquire the ability to do that, but none of those dentists can offer general anesthetic without specifically going through a residency. I have the chance of seeing thousands of people as they undergo this anesthesia. Typically what I'll tell people is you're gonna have a moment where you are coming in, you're nervous, but you'll get to a point where we're putting monitors on and different things, and we'll end up placing an IV. And that's really the port, the medication that's gonna take away that anxiety. Your experience is typically where you'll come in and the very next thing you remember besides starting to feel some of the medication is waking up and being all done. Sedation is very safe. It's actually one of the more common procedures that's out there, and naturally we only hear of potentially the bad reactions or bad outcomes. Now those are very, very minimal. The reality is those are most often patients that are already medically compromised. They have emergency treatment that's needed, and they still need to risk getting anesthesia in order to save their life. Private practice setting, we're very particular on selection. So we'll select patients that are healthy enough to undergo the treatments we're offering. If there's a situation where a patient might not be as ideal, then we would refer them to a hospital setting. Deep sedation or even moderate sedation are terms we use to describe often giving the exact same medications but at a smaller amount or degree. And so you'll get those same benefits of being asleep, unconscious, and having the pain covered and not forming memories. But the only reality is you're getting less medication, and it might be less stress on the body, and it might actually qualify somebody who couldn't undergo the stereotypical general anesthesia. Part of my training as an anesthesiologist is to be aware of the differences in populations, especially with medically compromised patients. There's a lot of drugs out there that can be regularly used, prescribed or not prescribed, and those things can have an impact on a patient's experience. And so if a patient is honest and open with us on what they're going through and what medications they're on, it really gives us an advantage to tailor their anesthesia to them. Their safety is priority number one, but a very close second is their convenience and their experience, but nothing will ever trump their safety.